During his speech to the joint session of Congress, President Trump had this to say about Medicaid. Take a listen.
We should give our state governors the resources and flexibility they need with Medicaid to make sure no one is left out.
No one is left out, but there are 4 Republican governors, as I'm sure you know, Kasich, Snyder, Sandoval, and Hutchinson, that say that this bill does not live up to the principles enumerated by President Trump. They wrote to the Republican congressional leaders saying, quote, the current version of the House bill does not meet this test. It provides almost no new flexibility for states, does not ensure the resources necessary to make sure no one is left out, and shifts significant new costs to states. So, Mr. Secretary, these are Republican governors that are objecting to your plan, saying that you're going to be leaving people out. It's not just a question of access. A lot of Americans are going to be left behind because the Medicaid expansion will be ended and there are fewer resources that will go their way. What is your message to these Republican governors?
Well, I hate to sound like a broken record, but what they're looking at is not the plan. What they're looking at is this first piece of legislation. And as you and they know, you can't put the kind of flexibility that's necessary for them to be able to fashion their program for their vulnerable population in the way that they see fit in the first piece of legislation, which is why it's this 3-phase or 3-part or 3 legs of a stool plan. And I've talked to countless governors, including the 4 that signed that letter, and talked about the kind of flexibility that they want and they desire to make certain that they're able to put in place a plan that cares for their vulnerable population. They're incredibly supportive of the kinds of things that we're talking about in that administrative phase and in the 3rd phase, where we actually are able to get to some of the insurance reforms that you can't get to because of the rules of the Senate in the first. At the end of the day, this isn't about just the process that we go through here in Washington. This is about whether or not the American people are going to get the health care that they need. Right now, many of them have health coverage. They've got an insurance card, but they aren't getting the care that they need because of the premiums that are increased, because the deductibles are up that they can't afford. We've got 1/3 of the counties in this nation that only have one insurance provider on the exchange. 5 states only have 1 insurance provider. That's not a program that's working for the American people. May work for government, may work for insurance, but it doesn't work for people. And that's what our goal is to put in place a system that actually works for the American people.
But one of the things that critics are saying, including Republican critics, is that first of all, premiums are going to go down for younger Americans, yes, under your plan, but they're going to go up significantly for Americans between the ages of 50 and 64, and that might price some of them out of the market, and they're not going to get the same kind of compensation from the government in terms of the refundable tax credits that they were getting from the Obamacare stipends that they were being given. And then in terms of the Medicaid expansion, these governors are saying you're going to be taking away the money that we need for this Medicaid expansion. So when you say that more Americans are going to have access to health insurance, that's not going to mean much to these people who can't afford it.
This is really an important point, because we need to stop in Washington measuring the success of programs by how much money we're putting into it. Imagine a Medicaid system that actually works better for patients, provides higher services for patients, is more tailored to the patients that are actually using it, and costs less. That's the kind of system that we envision, because it's actually possible if you put in place the kind of flexibilities and improvements in a program, again, that allows states to determine how best to care for that vulnerable population. This is really an important point, because this isn't just this first piece of legislation. If you look at the plan in its entirety, it's one that will work better for states, better for patients, better for the doctors trying to provide the care. There are a lot of physicians out there and a lot of other providers that have looked at the current system and said, I can't care for my patients in the way that we believe to be most appropriate because of the rules and regulations and because of the stipulations and because of the cost that's been injected into the program. So imagine, if you will, a system that actually puts patients at the center of it as opposed to insurance companies or the government. That's a system that we believe we can put in place, one that will work, a transition over a period of time to make sure that nobody falls through the cracks. That's the kind of plan that we believe will work for the American people.
Well, it sounds utopian, but I have to say, you criticize the Medicaid program because 1 in 3 doctors don't take Medicaid patients. And then you talk about, but the reason that they don't, according to experts, is because the reimbursement rate is so low. I don't know how you're going to improve Medicaid if you're taking money away from Medicaid. The problem is that doctors are not getting paid enough, and you're saying, okay, but we're going to do better with less money. And I don't know an economist who thinks that's going to work.
Every time you peel back that onion a little bit, and you drill down and you look at it specifically, you can see where there are wonderful opportunities for improvement in the system. The Medicaid program actually covers 4 different groups in our population: seniors, disabled, healthy moms, and kids. And yet what the federal government says to the states is you must treat those healthy moms and kids. You must have a plan for those healthy moms and kids that's exactly the same as the seniors and the disabled. That doesn't make sense to anybody who's looking at this, not just healthcare economists or individuals who are experts on financing and delivery of healthcare, but the common American ordinary people say, well, that doesn't make any sense if you're caring for moms and kids in the same way you're caring for disabled and the aged. So think about, imagine a system, if you will, that actually responds to the needs of those healthy moms and kids in a much more flexible and responsive manner. You can save huge amounts of money so that you've got greater resources to care for those who are aged and disabled.